Homelessness. I know you're going to say, Mr. Iona, 2 minutes is not enough to talk about it, and I think all of you would agree with that, but we do want to get a summary of what your plan is to address it. Clearly, the problem of homelessness is far more severe on Oahu than it is here, but we're feeling it here on Hawaii Island. So starting with you, Mr. Hanneman, talk about your solution and to what extent it would apply here on Hawaii Island.
I applaud Governor Abercrombie and Mayor Caldwell for doing what they're trying to do to come about with solutions for Oahu, especially in Waikiki. But therein lies the problem. You have a homeless problem here. You have a homeless problem on Kauai. You have a homeless problem on Maui. It should be a collaborative solution. And once again, I go back to the beauty of having a Hawaii Council of Leaders, where together we can come at solutions that will benefit all of the state of Hawaii as opposed to just one area. We've had a lot of experience at the county level on how to do that in Waikiki when I was mayor, and the problem was always trying to find solutions for the homeless once you remove them from the parks, the streets, and the like. And the state is well equipped to step up to the plate and be a partner. We don't have a Department of Education at the county level. We don't have a Department of Health at the county level. And mental health services that were drastically cut during the Lingo Iona administration is something that we have to catch up to, because 60% of the people who are chronically homeless need mental health services and treatment. So this is going to take a collaborative approach. It's going to have to also bring the social service nonprofit providers, and then the communities also have to be engaged. I hear a lot of time people say, get rid of the homeless in my community. But when you ask them, can they stay in a part of your community perhaps where a Housing First project can be built, or where we can have temporary shelter for them? Everyone is quick to respond, I don't like, just get them out. And we also have to be part of the solution. So this is something that's going to really involve all of us, because it's not going to be an easy problem, but we have some light at the end of the tunnel. The Department of Veterans Affairs is making a lot of grants available to cities and state. They want to tackle the homeless problem with respect to the veterans, and I want to maximize every federal grant and opportunity in that area.
Thank you, Mr. Hanneman.
Yes, the homeless challenge is really a challenge that all of us have to step up to. It really is about getting state, federal, county government, communities, and the private sector to work together to solve this challenge. Yes, homelessness has reached each and every community across the island. The model that we are using and that appears to work is really about housing first, finding partners, and I believe in each and every community, that can provide emergency shelters so we can get people off the street. It's about triaging the homeless, identifying those that are most motivated to leave that state of homeless. We should focus on those people first, those individuals and families, because they are willing to be part of the solution. It's about providing the full range of benefits and programs that the state, county, and federal government can provide. So it's about mental health services for those who have mental health issues. It's about substance abuse services for those who may have become addicted. It's about providing health services in community health centers and other providers if they have health issues. It's about access to federal benefits. 10% of the homeless across the state are veterans and are entitled to a wide array of federal programs and benefits if we were aware. So it's working at all of those levels. And then finally, there have been proposals by private sector people who would be willing for those homeless who have come to Hawaii in the belief that being homeless in Hawaii is better than being homeless in Nebraska or Alaska or wherever they're from. We ought to explore the option of giving them the airfare to send them back, because that will reduce our homeless problem here by one.
Mr. Iona, the homeless problem and how it would impact Hawaii Island.
A complex problem that has exploded across the state of Hawaii, wherein now that the health and safety of not only the homeless community, but everyone at large is at risk. And so this is something that needs immediate action. Now, what we have proposed is something that could be a supplement and a complement to the programs that have already been enacted in the various counties. First and foremost, a mobile homeless court. A homeless court wherein you have the option now of getting treatment and whatever else you need in regards to services via the judiciary. Second, as already has been mentioned, 10% of the homeless population are made up of veterans. The U.S. Vets Association, which is not a part of the administration, the U.S. Vets Administration, which is a nonprofit, is only one of 11 that's here in the state of Hawaii. They have the resources, they have the capacity to take in vets so that they can be lined up with the services and the other resources that are needed. The only problem they have is that the outreach that they're having to these vets are not taking place because they don't relate to the people who are outreaching to them. So as Commander-in-Chief of the National Guard, I would make it a specific program for our men and women in the National Guard to be outreach workers, to reach out to our vets and to bring them into these services. Now, it's been said many times that we have states out there who have specific programs wherein they actually buy one-way tickets for their homeless to come to Hawaii because the benefits are easier. And hey, let's be real, 365 days of sunshine and nice weather. Well, I want to put this out to my colleagues out there when I become governor, and that's this. If we have evidence that this is taking place intentionally, we're going to buy a one-way ticket and send them back at your expense. Last and not least, we're going to have what I would call being proactive and having what we call being preventive, in the sense of closing gates in the judiciary, in the public, in the prison system,
Thank you.
and in the military.
Thank you. Senator Ige, do you have a sense of the cost implications of your homeless solution? 1 minute, and where would the money come from?
Well, a lot of these programs are already appropriated by state government, so we do have mental health services. The federally qualified health centers provide health benefits to many people who are uninsured, homeless, and otherwise. So it really is about organizing and coordinating resources already committed to help people who are less fortunate. So the actual impact or cost would be relatively small. The big cost really is about housing and emergency shelters. And then it would be looking to work with the counties and other nonprofit community organizations who would be able to help us identify homeless solutions in each and every community.
Mr. Hanneman, what are the cost implications of your solution?
I think this really goes to the heart of prioritizing the budget and making this part of the budget sacrosanct, that you're not going to cut as much if you're going to cut. And most importantly, leveraging every county grant, every state grant, every federal grant. And then in some instances, as we've seen in Waikiki, the hoteliers are willing to step forward to help contribute financially to the homeless problem. So I really believe it takes creativity with the budget and making sure that everybody understands that this has to be a priority, and we're going to do everything possible when it comes down to it. But I go back to the Housing First proposal that David spoke to and I agree with. I tried to do it when I was the mayor of Honolulu with Kirk Caldwell as my managing director, and it really came down to NIMBYism. There's an area that we picked out on Oahu, perfect. The city owned the facility, but the community did not want it, so we had to basically put the program on the shelf. So you really need to participate in it so we can all be part of the solution and not just be part of the problem.
In regards to our specific programs, very minimal. But in regards to everything else, I don't believe there should be a price tag on this. This is a priority. This is a commitment. And so the funds need to be appropriated, plain and simple.